Hi everyone, and welcome inside the television studio here at Lorain County Community College. My name is Ron Jans, and it will be our goal every time we bring you in our studio here at the college to introduce you to not only the people of Lorain County Community College, but our programs as well. And today, you will notice, we have three of our people of Lorain County Community College. They're all from our Allied Health and Nursing divisions. And from my far right, it's Mary Grady. Mary is nursing faculty at LCCC. Dawn Scrow. Dawn is the director of our EMS and Paramedic Fire Science Department. And then Jill Ryder, who is also faculty here in the nursing division at Lorain County Community College. Now ladies, before we start, why don't you tell everybody watching what else we have here.
Well,
let's start with this. Mary or Dawn, jump in.
That's a cardiac monitor and defibrillator that we would train with in our cardiac scenarios, and pretty much any scenario that we would do, we would put them on a monitor.
Mary, behind you, you have?
I have an IV pump, and we use a lot of realistic props when we do our scenarios so that students can use what they would use in the hospital setting.
And Jill, this
friend
sitting in front of us?
This is our friend Lorain C. College, and she's
Her
one
first
of
name's
the
Lorain.
Lorain
Middle initial?
C.
Last name?
College.
That's very clever.
And she's one of several simulators that we utilize in our programs, and she has beating heart, and she breathes, and she speaks, and we use the simulators to help the students bring the patients to real life.
So we have nursing, paramedic fields here. Let's kind of find out a little bit about why you're here in the first place. And why don't we start with Jill? When did you know that you wanted to get into nursing?
Probably as long as I can remember. I've always had an interest in healthcare and have always loved to learn about the body and how it works, and so it seemed a natural fit. So.
How many years have you been involved?
I've been a nurse for 15 years.
15 years as a nurse.
Yeah.
Has there been any experience in those 15 years that has really driven home the point that you're exactly where you want to be and you made the right choice in your career?
Absolutely. I feel like, the thing with nursing is that you can change and you can move around, and it was one of those things I've always been drawn to, teaching other nurses, and loved, when the new nurses came in, I loved orienting them to the floors and loved teaching the patients about their diagnosis and, going home. And I was asked to take a group of students, and probably like 8 years ago, and fell in love with teaching and decided to go back for my master's in nursing, and really wanted to get into teaching, and couldn't be happier. Absolutely love what I'm doing.
Dawn, with paramedics and EMS services, emergency services and being a paramedic, what was the start for you?
My father was a volunteer firefighter, and my mother was a volunteer EMT. And seeing what they did and how they gave back to the community inspired me to also want to give back to my community. And so I started volunteering on our local fire department, and was working another full-time job at the time, but did this on the side, and just, again, fell in love with it. Loved working with the people, loved working with the equipment, and seeing outcomes on your patients, that how they're doing once you get them to the hospital.
And in that specific career, the outcomes of the patients, you could have highs and lows. Definitely.
We have many high spots and low spots, and thankfully the high spots kind of push you through those lows so that you remember why you're doing it, and are still inspired to go out and do it every day. Still get excited going on calls and seeing how patients do, and working with them and working with our fellow EMTs and paramedics.
What's been the most maybe memorable experience that you've had, or something that's still with you today?
I think that there's several things. I know one of the experiences is we had a head-on motor vehicle accident, and there was a young boy, 4 years old, sitting in the front of the vehicle, and we worked him for hours. We had, life flight there, everybody was there, and unfortunately didn't have a positive outcome, but he still stays with us, and remember that call.
Dawn, have you ever questioned what you were doing, or have you always felt that this is exactly what I was put here to do?
I think during the downtimes you sometimes wonder, is this the right thing? But like I said, those high moments kind of push you into it. And even those lows, you feel like, well, at least I was there for the family. At least, I could make some difference there.
Mary, nursing is really as much about being there as a support mechanism almost as it is about medically taking care of people too, isn't it? You're a faculty here.
Yes.
You've been a nurse for how many years?
I've been a nurse for 30 years.
30 years.
So a very long time.
How important is that bedside manner or that compassion that I think maybe all nurses have in them? It's not something that's taught, is it?
I think for some people it's just innate. They have it. And for some people you have to kind of work and bring it out. But I think everyone has compassion deep in them if we can try to get it out. But I think it's probably the most important part of nursing because there's just so much to know, and I'm forever going to have to resource and look in a book. But the one thing I can give to my patients is communication and being there and showing them that I care. And even if I don't know something, saying I will find out the answer. I will look it up. So I think just that compassion kind of like overrides everything else, that someone cares about me. That they remember how you, because what was it, that quote, that Maya Angelou quote that was, people will forget what you did. What was it? And what was it? Forget what you did, forget what you said, but they won't forget how you made them feel. So I think that's what nursing is.
A good friend of mine is a nurse and a graduate of your program. And she tells me all the time the reason she got into nursing is because there was a relative of hers that was sick, and she saw the difference that the nurses taking care of her nephew made in their family, and she just thought that that's something that she would like to do. So, thank you all for the care that you give everybody. The care that you give students, does it make you happy? Does it push you through the day? Is it why you're here? You had mentioned you fell in love with teaching when you had that by chance opportunity years ago.
Yeah.
Is that what keeps you here and keeps you going?
It does. You just see them, that look on their face when they get it. It just, there's nothing better. I feel like my role is sometimes just to be their cheerleader, and you can't really open their heads and pour in the knowledge, but if you can kind of model what you want them to be and try to give them scenarios, and it's when you take them to the hospitals and they see what you're learning in lecture, and then they finally can get it put together in that like aha moment that like, oh, this is what you're talking about. There's nothing better than that.
Dawn, how do you get an EMS, a fire science, a paramedic student in the aha moments? I mean, how do you create the atmosphere that puts them right in the the line of fire or the heat of the battle?
Yeah, well, that's what we're looking for. We love seeing those light bulbs go off on above their heads, and so part of that is you give them the lecture, you give them the base knowledge that they need, but then we run labs and run scenarios, and they're very realistic scenarios, so that the first time someone comes to a patient who is experiencing chest pain, it's not their first time in the field. They've been through that scenario at least, and it's been very realistic, and they know the steps that they have to go to. And so doing realistic scenarios, using simulation has been a huge benefit for our students.
Mary, let's leave or take from where Dawn left off, and she mentioned simulation. You've been in the program for over 30 years, or at least a nurse for over 30 years. How has the instruction changed, and how have simulators like Lorain here changed the way you teach students?
Well, I think in the past, or when I went to school, there was more time in a hospital setting. There were more hours that you had to put in. And as things have changed and become more college-based, they went away from you just doing the care at the bedside, but there became that component that you got to know all the stuff that goes behind what you're doing. So when they started to come into the colleges and universities, I saw where people were having that disconnect between I'm learning this in school, but then I have to go out here and do it, and it's not making sense. And so when simulators came around, it was kind of like one of those things where you could take what you learned in class, do it in a controlled environment, and then when you got to the hospital and you saw it, it made more sense. And a good example is there was a student called me a couple years ago. We had the simulator and we made it quit breathing, and it had a full-blown code. And I think you were part of the code thing. And then, and she was like, the whole code just freaked her out. And so a couple years go by, she's a nurse now in the hospital, and she called me on the way home. She had just been in a code, and she goes, it felt like I knew what to do. I had already done it before. So I was an autopilot during the whole thing. And I think that's where simulation has helped, because we're not getting all that one-on-one that we need sometimes. And this is making you fill in the gaps and to practice things you might not get to practice in the hospital.
Right.
Tell us some of the things that you're starting to be able to do with simulation. It'll never be real, but boy, it's getting awfully close, isn't it?
We have
Any of you.
Yeah. Well, we have mannequins that breathe, that have pulses, they blink, even their pupils dilate and constrict. So, you know, that makes them a real person. And then the students internalize that this is someone I'm working on, and I think they start to care for them. And when you care about your patient, I think you strive to be a better person and so that you can take care of them as best as you can. And so I think that simulation helps with that. And the more realistic you can make it, it makes it lifelike, and they go from there.
They can do a lot of skills on, it's amazing. They can, you know, put an IV in their arm and you get the flashback of blood like you would a person, and you can put in a catheter and you get urine, and I mean, it's amazing, the technology.
And you can have the same hiccups that happen in the field. So, you know, the first time your IV blows or something isn't working, that's not on a real person. You have a mannequin that you can practice on in a low-risk environment, and I think that helps.
And what I love is that as the instructor, we can make those problems happen so that everything doesn't go perfect, because nothing ever goes perfect. So what do you do when it goes wrong?
Right.
We really strive in these simulations to create emotion, because they'll remember it. And you know, sometimes if it's not going well, sometimes we make the simulator die and to show them.
Well, like you were saying, the code.
Yeah.
You know, she'd never, or was it you, Mary, that had said she'd never experienced a code,
Yeah.
but then was able to experience through the simulation, and that helped her through.
Yeah.
And one of the constant goals of Lorain County Community College is to identify the needs of our community and then work very hard to serve those needs. And obviously the allied health careers are one of the needs that are driving education today and employment in the future. We're going to take a short time out, but when we come back, we're going to introduce you to our University Partnership Ridge campus and all of the neat simulation devices that we have there that Jill and Mary and Dawn are able to instruct our students of the future on, right after this. We are excited to take our cameras inside the labs, the simulation labs of the University Partnership Ridge campus, which is in North Ridgeville. And in those labs, the pictures and video that you're looking at now, we've got lots of exciting simulators and devices for instruction of nursing students. Ladies, why don't you tell us a little bit about what's happening on the Ridge campus right now as far as our allied health and nursing careers?
We have a lot of really cool simulators that we have just gotten in that can do the things we talked about, like breathe, cry. The one can cry tears. And the one that we're getting in that will be available for students is the birthing mannequin that can give birth, which will be pretty exciting.
It's a simulator that actually gives birth.
That actually gives birth, and then you take care of the baby and the mom afterwards.
Yeah.
And
That's pretty amazing.
That's pretty amazing. And we have a baby, so you can practice just taking care of infants and pediatrics. So I guess we're going to be from birth to, I guess, death. We're going to have simulators to take care of the whole developmental span.
And some of the things that we're doing out there is we have the opportunity to offer things to the community and to our area hospitals. And Dawn is offering ongoing education to the paramedics and firefighters. And do you want to talk a little bit about that?
Sure. We can bring them in and give realistic scenarios for your advanced cardiac life support, for your pediatric advanced life support. And again, it's especially with pediatric patients, I think it's nice that we have these simulators, because we don't often see pediatric patients. But when you do, you need to be on your game and ready to act. So having those simulators available is a huge benefit for our students. And working with the community, bringing in the local paramedics, firefighters, EMS agencies, and hospitals. And I think that'll be nice to show them what we have to offer and serve our community that way.
As instructors who are not only obviously teaching the field, but who have spent time in the field and are currently in the field, what is the demand out there for people studying in the allied health and nursing careers?
I think that whether you're going into nursing or you're going into any one of the allied health fields, you know, ultrasound and radiology, if you look through the classified ads, there's, you know, take your pick, you know, where you want to go. And they're definitely in our area, as much as we're saturated with hospitals and places to go in our area, there's still a need for nursing. And as we continue to look forward into, you know, projections, they're anticipating a lot of nursing retirement, and that we're going to need a lot of nursing grads to take those positions.
And we keep, you know, hearing that the, you know, the baby boom generation
That's right.
is at a point where there are lots of people out there who need care and need taken care of.
Yeah.
So the jobs are there. But Dawn and Mary, is nursing for anybody? Or do you really need to make sure that this is something that you want to do as a career? Because a lot of times, especially in 2013 with unemployment what it is and people looking for solid careers and careers that will have a future, and allied health would have that. But do you have to be careful that you make sure that you're ready for what it's really about?
Yes, I think it can't be about a paycheck. I think it has to go back to wanting to, you know, care for people and provide a service. I think we have to be based on service.
I think so too, and it's not for everybody. I have had students before that start and just say, I don't think I can do this. You know,
Right.
somebody recently, they withdrew and they said, you like people more than I do. They said, I just don't want to do this. I think it's more than a paycheck. I mean, if I wanted a good steady job and a good paycheck, I could probably do a lot of different professions and obtain those outcomes. So, and probably have
agree.
better hours because
Yes.
you know, you work a lot of holidays, you work a lot of shifts, you work a lot of, so I think you really have to want to do this.
I agree.
You
I
know,
agree with you
to
there.
really do it. It can't be because of the money.
The employment is there, though, isn't
is.
it? I mean, our graduates do well.
Yeah.
They do very well. A lot of the local hospitals like to hire our graduates because they feel like they're very well prepared. And so that's like a really good plus for us.
Absolutely.
Yeah.
National test scores prove that out too, right, Jill?
Yeah.
We do well?
We do very well. Our, I can speak for nursing graduates. We have over 90% or around 90% success the first time around on their nursing boards. And I know as far as like allied health, our, you know, lab science, Jim Daly's program has a 100% pass rate. With the dental hygiene, 100%. So they definitely, we're right up there in top performers.
And we are all accredited. All of our programs have accreditations that we've met, like these national standards that were higher standards. So
Right.
we can say that we are accredited programs,
Right.
which means a lot that you went to a school that was that high, you know, in the standards.
Mary, I want to kind of circle back to where we started. And, you know, we said it in these programs, we want to not only introduce the people of our community to the programs on our campus, but also the people who are teaching those programs, and you know, hopefully personalize you guys a little bit as to something other than just the instructor standing at the top of the classroom. You told me that you think that you wanted to be a nurse for as far back as you can remember. Can you remember back to when Mary was a little girl? And
Yes, I can remember back then. It's not that far, I don't think. So, but anyway, I remember going to visit a family member in the hospital and just being like really awed by the nurses, that they were doing all this stuff. They looked busy and they looked like they were like important. And when they spoke, everybody listened to them. And it's like, oh, they have power, you know? So, and I was intrigued by that. And so as soon as I could be a candy striper, I actually went and was a candy striper for a couple of years.
for those of us not of that era, Mary.
Yes, a candy striper is a volunteer. Yes, that goes back a little, so I'm aging myself. But it's where you can be like a teenager and you can go in the hospital and you can start to like kind of see what's happening. And they may have you do things like filling the water pitchers or bringing people up from admitting to their rooms, you know, and doing little things or passing the mail. But you're in that hospital environment, so you get to know whether you really like being there. And I guess I did. So that was
Best day for you?
the
Can
best.
you remember one?
The best nursing day?
Best day, yeah.
Best day. I actually had a good day yesterday in clinical because my clinical group, they went from in the very beginning not being like together really to like yesterday they were functioning like nurses. Like they weren't students, they were nurses yesterday, and their thought process had went from I'm a student to I'm a nurse. You know, and yeah, and it was a good day, 'cause, you know, they told me I didn't like you in the beginning, but I like you now, because all the being tough on someone was to get you to that point so you could be competent. And even the nurses on the floor were like, they're really good. And I'm like, yes, they are. So that was a good day yesterday.
Dawn, you grew up in Eaton Township, right here in Lorain County. You've spent your entire life here. You said your mom and dad were both involved in EMS and paramedic careers. When you decided to do that, did they try to talk you out of it? Did they encourage you? Did they sit you down and give you the realities of it?
They were very supportive, but they did, you know, say what it was about and things like that, so I was prepared going in.
Do you mentor other people? I mean, do you, and maybe this is a question for all three of you, do you see young students interested in a career? And
Yes, I think that we all play that role of counselor, instructor, many different hats, and we see people come in who aren't sure what they want to do. Maybe they take our intro program just to see if that's what they like, and then they, you know, get a taste for it and love it, and then we see them progress. They go from wanting to be an EMT basic to going to a paramedic and increasing their abilities in the field. And then it's always nice when you actually see one of your students, you start working with them in the field and you see how well they perform and you see that they really got it, and it's very exciting.
now let me ask you this, when you were first thinking about getting into that career, was it a career in general that females chose, or was it something that was in some ways discouraged for a female to be in?
I know that I had some concerns going in that there weren't very many females on the department or in the field at all, but I had a very good department to work with and they welcomed me, and they didn't seem to see a difference between the male and female roles, which was good.
Jill, for you, best day as a nurse?
Best day. I think one that stands out was we had a patient that came in and she was 18 months old, and her parents knew that she wasn't doing well. She was born with an odd like metabolic disorder, but she wasn't doing well. And when they came in, they wanted the parents to decide right then and there what they wanted, what their wishes were for this child. And the day sticks out because it was a horrible day for this family, but there was a lot of newer physicians there, and they were kind of pressuring them to make a decision. And it was one of those days where you knew what you had to do, but I was kind of nervous to step up. And somewhere, you know, you get the gumption to kick everyone out of the room. And I brought in some water and some tissues, and I kicked everybody out of the room, and I told them they needed to give this family a minute. And they just needed to be with their child, and they needed to talk as a husband and wife about what to do. And afterwards, they said, we appreciate so much what you did for us, because we felt so pressured, everyone just standing there looking at us. And it was, you know, it was one of those days where you left driving home going, I did the right thing. And it was hard, but you know that you did what was best for them. And you talked about, you know, the compassion, the caring is more nursing. And it was one of those days you felt like, you know, I didn't do anything medical. I gave them some water and some tissues, but I felt like I did a really good job that day.
But you were a person.
Yeah.
But you know what you did too that just stuck in my mind when you said that story is you stood up to the medical staff and you said, this is what my patient needs. And I think that's really nursing, is that you're standing up for that person.
You're being an advocate.
You are, and that means sometimes standing up to the medical staff and saying, this is not working.
Yeah.
It's a huge responsibility, isn't it, being a nurse?
It is.
Or being a paramedic?
Yeah.
Or being anything involved in the allied health and nursing careers. Does that, and we've only got maybe about 45 seconds left, so quickly, does that responsibility ever overwhelm you?
I don't think that it does. Do you feel like it overwhelms you? I feel that I need to be my best because of that.
Yeah,
and people are expecting me to perform and to stand up for them. So I feel that.
Yeah. And I know one of the things too, like we tell our students, is you have to leave everything that at your home in your crazy life, you leave that at the door and you walk in and you're there for that patient. And because of that overwhelming responsibility, you got a job to do, but it's a rewarding job.
Well, Jill and Dawn and Mary, and Lorain here. Thank you all for coming inside the television studio at Lorain County Community College.
Thanks for having
Really
us.
appreciate you
Thank
guys
you.
being here. It's always our goal to not only bring you the people, but the programs of Lorain County Community College when we go inside the studio here at Lorain County Community College. Have a great day.